We have to start with some of the fundamentals. I think that, a lot of times I have patients that's like, oh, just tell me the one magic pill. And it's like, honestly, so much of that is the basics: sleeping well,
Mm.
eating well, simple hygiene. Um, don't just overlook those things.
We could spend all day talking about all the different um, vitamins that are out there or herbs, but we're going to focus on a couple of really key ones. So our big ones are going to include vitamin D, zinc, vitamin C, and elderberry. So vitamin D, there is this really big misconception that vitamin D is just for bone health or for places where you don't get adequate sunshine. But it's not just for bone health. It is so important for our immune health. Vitamin D is huge.
Major. Yeah. I almost feel like if there was almost just one nutrient, I would probably say put that one on the top. So don't just assume because you live, in a place that's nice and sunny that your levels are good. Also, don't assume because, okay, I'm taking vitamin D regularly that your levels are good either, because some people need to take maybe more than others. And it also the different delivery methods, whether it's chewable or capsule or whatnot, um, may be more absorbed for some than others too.
Zinc. So what's really important to know about zinc is that not only does it play this really critical role in antiviral immunity, but those individuals who are deficient in zinc are more likely to acquire viral illnesses. So there are going to be some of these things that we can say, would we do this not only for prevention, but then for treatment? So vitamin D, definitely prevention, and we'll talk about treatment as well. But same thing with zinc. So zinc is it helps to decrease the viral replication.
Generally, you want to take zinc in kind of more short-term acute dosing strategies, because long term it can throw off your zinc copper balance. And I've commonly been seeing copper deficiency this year because everyone's like, okay, zinc, and they're getting zinc at the grocery store, and they're getting zinc everywhere, but not really the discussion about how then that can throw off the copper balance there too. Vitamin C.
Yes. So vitamin C. So this one is going to be a really potent antioxidant. It also helps to contribute towards our immune defense. And so this one, what's really cool about vitamin C is it actually can accumulate in the cells to be able to kind of attack the viruses a little bit more. And so it is really beneficial, again, not only for prevention, but then also for treatment as well. Okay. Next one is going to be elderberry. This is a powerhouse. It is packed full of vitamins, especially vitamin A, vitamin C. It also has antioxidants that are really important for protecting our cells. It has been shown to be hugely beneficial in lots of viral illnesses, especially flu. And elderberry syrup was shown to be just as effective as Tamiflu at decreasing the duration and severity of symptoms.
I think what's most important is what they're really going to do. You know what I mean? So something is better than nothing. And I feel like so many of my patients say, oh, it's not the right way, or like, oh, I can't wait to take it with food or without food. And they get so caught up in what do you call it? Analysis paralysis kind of a thing.
Yes.
And so then they don't get any. And I'm like, well, it's definitely not effective that way.